I like her dance company.
Oh, thank you. Oh, they're doing the Nutcracker again up at Mercy.
My wife said she'd go there. She won't go to the other one.
Coming to you live on the Government Access Channel from Mario Bagnoni Chambers in beautiful downtown Erie. It's the Taxpayers Hotline Show with your host, Kaz Kwiatkowski.
No, I won't.
Well, welcome. I got a new guest today. John's not with us. This is Kaz Kwiatkowski, City Councilman, and I have Cindy Purvis here. You want to introduce yourself, Cindy?
Yes, Cindy Purvis, resident of Erie. I sit on the board of a nonprofit, Healthcare for All PA.
And Cindy's asked me for a long time to be on the show, and we finally figured it out. We found a slot, and Cindy, what do you want?
Sure. Well, I'd like to talk about some legislation that's been introduced in Pennsylvania. It's single-payer health care. Some people call it improved Medicare for all. What it is it's universal health care. And that means that everybody, every single person would have health care. Under our proposed legislation, every single person pays for it. And we, by doing it that way, we can get rid of the health insurance industry that really just is there to take money from the patients and the doctors, and we can streamline the process. So the legislation that's been introduced, it's a nonpartisan legislation. We have supporters on both sides, and actually one of our former presidents of our organization, Dave Stile, served 16 years in the Pennsylvania House. He's a Republican. So this is a nonpartisan issue, but we really feel the benefits to everyone and our pocketbooks.
So you would pay as an individual?
Everyone would pay, and how this particular bills, they're both mirrored bills in the House and the Senate. Every family would pay 3% of their income. So to give you an example, if you made $100,000, it'd be $3,000 a year. It would pay for all your medical costs plus prescriptions, vision, dental, mental health, addiction treatment. It would all be covered, every bit of it. So it would really be helping everyone. But one of the most important things also is in your taxes and your budgets. I know you have a heavy responsibility as a city councilman for the budget of the city. Now, every couple of years I do a study on the budgets. The last time I did, the city of Erie would save $6 million a year on employee health care costs under our proposed legislation.
It almost sounds too good, though.
It does. It's amazing. And I'll tell you how.
I mean, you're not going to lose any coverage now with this?
No, you'll have more coverage. And there's
pre-existing
no
conditions and everything?
Everything. And no co-pays, no deductibles. And we did a study in 2009 after Pennsylvania passed the Right to Know Act. And that allowed us to go to every single taxing body in the state, which is 501 school districts, over 2,500 municipalities, 67 counties, and the Commonwealth itself. As employers, how would they fare under this? The average paid was 25% of payroll went to healthcare cost. Under our bill, families would pay 3% of their income. Businesses, including public businesses, would pay 10% of payroll. So what we're looking at is the average is 26% of payroll that businesses are currently paying.
So they'd be 16% lower.
Right, so that's how the city would save. The school district was humongous. It was over $12 million a year for the city of Erie School District. Now, the other school districts in Erie County, their budgets are much lower, their payroll is lower, so they would be lower, but every single one of them saved money. Well, everyone had comprehensive health care with no deductibles and no co-pays.
Hold that thought.
Okay.
Go ahead, caller.
Hi. Hey, Cindy. It's interesting to hear what you're talking about. How does this work for senior citizens on Social Security?
They would also be covered. So what they would not need is their Advantage plan. So under their Advantage, nobody would need an Advantage plan, which I think people aren't understanding now. I know I had a hard time understanding when I went on Medicare. And choosing, and the difference between the plans, the Advantage plan, and I have an article
Is
here.
that like supplemental?
Well, there's two of them. There's a supplemental and there's Advantage companies. What the healthcare insurance Advantage companies do, they charge you a fee, and some of them actually charge you no fee. They get the money from the government. All the money that everyone's paying into Medicare, they dip into. That's why Medicare is finding itself in some difficulty, because these Advantage plans are dipping in, and in some cases, I have an article here by a wonderful research journalist who's saying some of the big ones now are actually being investigated for overcharging the government. So nobody would need those Advantage plans or those supplemental plans. And everything would be covered, including all of their prescriptions. So no one would have to worry about that donut hole.
You don't think these...
But
Well, go ahead, ma'am.
somebody like myself who's not on any prescriptions and really has no medical health issues, though, it's going to cost more money for that 3% of the income, because you really don't use the health care coverage for anything because you're healthy? Is that how I'm understanding it? Maybe I'm wrong.
Oh, no. I think you're right. But if you look at the big picture and all that this covers, do you own a home?
Yes.
So you're paying taxes for your home. So as I said a few minutes earlier, your taxes for your school district and your taxes for the city for your home are really higher than they need to be because of the health insurance cost that they have to pay for their employees.
Benefits and payroll are
The
a big part.
benefits and payroll, a big part of that.
Let me ask you a question. This woman brought up a good point, though. Can I interrupt, ma'am?
Yes, go ahead.
What income do you use, Cindy? Like, say, there's different kinds of income.
Right.
Okay, now what would they base the 3% on? Obviously, if you were working, it'd be your 1040 income.
Right.
Your earned income.
Right.
What do they consider earned income for, like, retirees? Would they pay on Social Security and pension, or?
Yes.
So it'd be total income? Kind of like what
Total
the
income.
state does with the SNAPS program, where they add up all the income.
Yes.
There's nothing exempt like.
As far as it's been introduced, there's nothing exempt.
Okay.
Right. So it's the total income. So if you're a multimillionaire, it's a percentage of your total income.
So if somebody gets,
So everyone's paying the same percentage. And do you mind?
if you're only on Social Security, you might be only getting 24,000 or something, so.
Right.
Yeah. Go ahead, ma'am.
So with this program, say for the sake of discussion, you need hearing aids. You get free hearing aids of your choice. You wouldn't be limited to any particular kind. And you get free glasses and free dental care and all that.
Yes, absolutely. Now, if you went in and said, I want that $800 pair of glasses because I really love those frames, they really stand out, I think that there will be some limits to that, to what is everything is what is medically necessary.
Just like it is now. I mean, you can't, even in my plan, you can't go in there.
Oh, sure.
Yeah. There's a limit to what you get.
Well, I do think that healthcare costs are astronomical, out of reach, and I think what the pharmaceutical companies do with certain medications is criminal. Just take case in point, the EpiPen. We have a granddaughter who desperately needs to carry an EpiPen, and those are $600 right out the chute.
Yeah, and they only last so long, too, right?
Absolutely, and if you don't use it all year, too bad, it expires. And they need several EpiPens. One needs to be kept in the school, one needs to be kept at home. They cost a lot of money, and it would be interesting to see if this type of program eliminate that burden for families.
Right, that's the intent, to make one whole system, like most other, if not all other industrialized countries in the world have a universal system. They all differ a little bit from each other, which is almost a benefit to us in America, because we can look at them all and say, we like this, we don't like that, and actually craft for ourselves the best.
What if you're retired, you don't have an employer? Your 3% is still 3%?
It's still 3%.
Okay, it doesn't, okay.
Doesn't.
Okay.
Or if you're not working or on welfare, you're paying 3%.
Either way, okay.
Either way, you're paying the same amount for everybody. Everyone has skin in the game. It's affordable to everyone. And by putting it all together in a big pot, we're able to cover everyone.
Well, small businesses where most people, I didn't mean to interrupt you, ma'am.
No, you're not interrupting. Ted. This is good.
When I was in the public sector and I worked for a small company,
Right.
they couldn't afford insurance.
Correct.
And, you know, they weren't like the city or the school district or the state or bigger companies. That was their biggest problem, was how to insure their workers. I always hoped there'd be some kind of group plan, just like the legislators have,
Right.
you know, where, you know, it was equitable, but it never was. So I think this is sounds like a little, you know, it sounds like a lot better.
Right, and what I have found, because I used to own my own small business, is that under this, most mom and pop small businesses can't afford health insurance at today's cost for themselves or their families.
No, not really.
So under this, they could afford for themselves and their families, and there's other benefits also, such as workers' comp. Workers' comp is a heavy load for some businesses. After this comes into effect, they wouldn't need the medical part, because if you get hurt on the job, if you get hurt in a car accident, you're just covered. Nobody, when you go to the hospital, nobody asks you and bills somebody else. You're just covered. So workers' comp then would only take care of lost wages and liability. So even those costs should come down under this.
I have another question. How about, would there be mandatory vaccines and things like that because of this? Or would we still have freedom of choice as to what we actually want to put in our bodies and how we want to take care of our bodies? Since, I think freedom is kind of running amok lately.
What do you mean? Would they force you to do certain things, you mean, or?
Yes, like mandatory vaccines.
Oh,
Well, nobody's going to, like today, nobody tells nobody lines you up with soldiers beside you and gives you a vaccine.
Cindy, I beg to differ with you. I was forced to get a mandatory flu shot, and if I didn't get the flu shot, I was going to lose my job.
you probably worked in a hospital, right?
Yep. And as a result, I ended up with a extremely severe vaccine reaction, and I almost died.
The thing there is, though, you have to sign an agreement ahead of time. You know, most bosses won't do that to you, but hospitals, I guess, I don't know how they work. I don't know what you signed when you took the job. I do know in the Army, they had that argument many years ago when they had the swine flu shots, and they were not very successful. And they basically told us, you take the shot or you get court-martialed, you know, but that was...
Well, that was the Army too, so that was different.
But if you sign an employment agreement and you say,
Sure.
I abide by the health rules, she's probably stuck and she has, you know.
She probably is, but if you're asking if under this plan we're going to force people, what this plan does is finally give freedom. It finally opens up the freedom so you and your doctor can choose what you want and where you want to go. I mean, we're about to be hit with a dissent decree that expires next June, which is really going to take away a lot of freedoms. People who are currently Highmark customers may have specialists at UPMC that they're not going to be able to see anymore.
I have to get all new doctors.
Yeah, isn't that something? Under this plan, everyone has freedom. You can see whatever doctor you want to see, whenever, go to whatever hospital. You and your doctor choose what you want for yourself. So we finally have freedom in healthcare under this.
Well, this is very interesting, and thank you, Cindy, for coming on. Thanks, Kaz, for mixing it up here.
Well, I'm trying to get more people to come, with different ideas, and Cindy's been after me for quite a while, and I said, just tell me when you want to come on, I think it's important because everybody's confused. And like Cindy said, in less than, not too long, a little over 6 months, 8 months, you're going to see the effects when the consent decree, people are going to now have to be faced to either pick new doctors or new hospitals.
Oh, can I add one more little thing in here?
Yeah, go ahead.
It's a little different from what you're talking about, but I do have to say, I'm a proponent of you should be able to eat the healthy foods that you want to eat, and you should not be dictated or limited. And currently, there is a local small business, Pot of Gold Dairy, and they've been in the news in such a negative way. Apparently, there was a concern that their milk might have been contributing to outbreaks of salmonella in the area. And it's been reported in the news that, they have salmonella in their milk, and it's not true. What's being put out in the news, I thought Erie was all about wanting to keep small business and growing small business. And this poor family, they have been around for 17 years, and they're under a huge attack. And I called the health department today. They hung up on me, unfortunately. But, they're guilty until proven innocent in the news, and they're guilty until proven innocent, unfortunately, by the health department. And that's really sad. I've drank their milk for as long as that dairy has been around and never been sick. And if you look at statistics and research, pasteurized and homogenized milk have more incidents and more cases of salmonella and other pathogens in their milk than natural raw dairy milk. And I just have to put that out there. I feel bad. Here's a wonderful small business in our area that's being attacked, and it shouldn't be.
Yep.
So,
Thank you for calling, ma'am.
you take care.
Okay. A lot of questions already.
Yeah.
But that's good, though, because it is a subject that I tell people all the time, that's one of the biggest costs in any business.
Right.
Go ahead, caller.
Hey, this is a very interesting show, Kaz.
Well, thank you.
I got a couple comments. First of all, what happens to that Medicare money that comes out of our Social Security check? Who gets that?
That would go into the general fund to help fund health care for everyone.
So we got to pay I pay $120 a month or something like that, and then I got to pay 3% on top of that, right?
Well, that's my understanding as it is right now. As this has just been introduced, as it goes through the legislature and people look at those and do more in-depth studies on the cost, then that'll all be worked out. But that's my understanding right now, yes.
And I'm sure that they'll have I would imagine they'd have some public forums on
Oh,
this.
many. We're trying to get our local legislators after the election to have a forum here in Erie on this. And
Because he brings up a good point. There's a lot of unanswered questions.
there are, but with any legislation, that's how it starts.
Okay, I got one more question for you. Kaz, you're right. I right now I have all UPMC Vincent doctors, but I got a UPMC insurance.
Oh, yeah.
So I got to switch my insurance because that's what's going to happen. So here's what's going on. It's driving me nuts. I checked Aetna, I checked United, and I checked Highmark. Currently, currently, there's a pill I'm taking. I'm not going to tell you what it is, but
Well, you shouldn't either, so,
it costs me $10 a month. Okay?
right. With your present insurance, you mean?
Present insurance.
Okay.
Now, yes. But I got from Aetna now, they want $100 a month for that pill. Same pill. They put me into class 4. Okay, now, United wants $47 for that same pill.
Still more.
And Highmark, their new plan, which I'm going to go to, it's $5 a month. I got 3 different prices. I got $100, $47, and $5. So naturally, I'm going to go to Highmark. But the Highmark got some good things in there too. But that's would solve a lot of problems, which you're talking about with the prescription.
So you have, like, right now you have UPMC doctors, right?
I have UPMC doctors for the last. No. I have UPMC insurance.
Oh.
I have all Vincent doctors, and I have to go. They won't take UPMC next year. I got to get either any insurance but they will take. That's what they told me.
So you're going to go with Highmark, you think?
I'm going to go with Highmark because first of all they got a 0 premium, and they have dental, cleaning, everything. They have eye, they have hearing aids. You pay $700 per ear, a copay, and they pay the rest. Those are $5,000.
Yeah, I'm trying to find out what the coverage areas are. I know Highmark has a pretty good coverage area.
Yeah, there's one plan that's 0.
You know, what's bad about all this is you should have been at the meeting we had at the city here. And when we were talking with Aetna and these other companies, they tend to be tougher on, like, say you have to have a procedure. With Hammett, with UPMC and Highmark, they're pretty loose. You know, the doctor signs off, you get the procedure. With the national companies, they're a little tougher. And as you've seen with the pills, look at the difference, right?
Yeah.
I mean, and I got the same problem. Just by luck of the draw, the doctor I picked was at the one time he was independent, but then he sold out to UPMC, and now he retired. So I got to find a GP. My endocrinologist is a UPMC doctor, and I picked him because the Highmark doctor wasn't seeing anybody at the time, and I needed immediate care. My wife has the same problem. We got a mix, and you know, I don't think people realize what's it. And when the sad part was, when they did a survey, we found out it's really 50-50 down the line. In the old days, it would have been, you know, I hate to say this, the Catholics went to one and the Protestants went to the other, but that's out the window now. But you still have people that are divided, you know, some got good programs at UPMC, some got, and it's you know, when you can't use the benefits, you know, they should have made this law when this thing expires, this consent decree, they should have allowed people to keep their doctors that had one. And then anybody new coming on board, they would have to play by the game because, you know, you got time invested. You're not talking about a GP. When you got a specialist doctor and he's had you taken care of, now I got to switch in midstream. And who knows what the new doctor's going to do.
Well, you know, and this.
You're still there, right, sir?
Yeah, I got one more question.
Go ahead.
Well, we got Cindy here. Go ahead, ask her.
Hey, here's something else I found out. Now, listen to this now. If I got Highmark insurance next year and I get in a car accident and the ambulance takes me to Hammett, that's the trauma center.
You'll be covered, they told us.
Yes, Vincent will cover the emergency, and they said until you're stable.
Right.
Transfer you to Vincent, and they have an agreement that each hospital will cover that. But with the lady saying here, you could go to any hospital, and there's no problems. You know, it's going to cover everything. The doctors, the hospitals, which is very good. And I'm going to hang up, but I'm going to tell you, I'm very interested in what this lady's saying. And thank you for coming.
Oh, thank you. Well, this is a great example of how we have, as Americans, have no freedom in our healthcare system. The insurance companies seem to just control it all.
Well, but now the hospitals are part of the problem.
Well,
now they're buying into
the
it.
The hospitals are owned by the insurance companies.
Yeah, that's what I mean. Now
Which is why we're kind of wondering, is this really what we as citizens intended years ago when we set up the nonprofits? for them.
Right.
So now the insurance companies are benefiting, and some of their big CEOs, I think Jeffrey Romoff, the CEO of UPMC, made $7 million just in salary a couple years ago.
Cindy, think of this, okay? Hammett's got an excellent cardiology department. At least they claim that, okay? Hammett claims they got the best stroke center.
Right.
Hammett's got the benefit of UPMC. You know, Allegheny has their benefits. But you as a consumer, you can't pick and choose. Like, let's say you have whatever happens to you, you say, well, you know, really UPMC is a better hospital, or Vincent is. You no longer have that choice, you know.
Right, right. We don't have that choice. And look what they did, I mean, to the cancer center.
Yeah, they split that, but now they're both doing it separately.
So now they're both doing it separately, and on one hand, does it help our construction industry? Yes, because now they have jobs constructing. But in the end, why do we need that? These hospitals are what, 3 miles apart?
It wasn't, you know, that,
What a waste of money.
that cancer center, when my wife went there,
Yes.
and I thought it was the best example of cooperation. There was no problems there. Everybody loved it. I mean, you don't love going there, okay, number
Right.
one.
Right.
But if if it was an example of, something that was working.
Working together, and so now they're spending all this money to make all these beautiful, beautiful places. And I'm telling you, when you're sick, very sick, all you really care about is the care, is the quality of the care. So all this wasted money, where is this money coming from to be so lavish? This money's coming from our insurance plans.
Yeah.
We are paying for this. And even if we're on Medicare and these Advantage plans, we're still paying for it. So we're paying too much. And here's an example of how I believe Americans need to take back control of their healthcare system and streamline it and do what other countries do. I mean, my daughter had a injury. She fell and tore her meniscus. She had to wait a week for her MRI. Now, I spoke to a Canadian woman, and I asked her how long she would have waited in Canada. She said she had an accident. She would have had her MRI immediately. Do you see the difference?
Well, even
so
in
we have
the-
huge waiting lines in
Even
our
in the United
country.
States, if you go to Cleveland Clinic, they take you in and out. How do they do it? And they're way bigger, and other ones can't. Or you go to a little mom and pop hospital, you get taken care of. There's so many inadequacies. But it's crazy because were you on that committee years ago when Father Tex started?
No, I just started working a little bit with Father Tex when he passed.
He put us on this committee.
Uh-huh.
And we were trying to figure out why the cost was high. At the end of the day, everybody was going like this.
Right.
And it was doctors blamed this, the hospital blamed this, the pharmaceutical, and he had all those people there lined up. We had like a big meeting. At the end of the day, it's like there was so much blame to toss around, but you got to look at like the pharmaceutical companies, number one.
Oh, absolutely.
Here the VA's buying pills in Canada, but I can't buy pills
Right.
from Canada.
Right, it's illegal.
But the VA is buying them.
Well, the VA system is a socialized system,
And then-
which people don't understand.
And give us the
It's a
same
true
plan to-
socialized system.
They give us the same plan the congressmen and the prisoners have,
Well, yeah,
right?
yeah.
I don't say I want to go to prison, but
Right, right.
how about the congressional
There
plan?
was a story a few years ago of a gentleman who committed a crime. It wasn't a violent crime, but he committed a crime because he
So he get treated.
desperately needed health care. And how pathetic is that to say that?
Well, look at our congressmen, they're out of touch. A lot of them,
Out of touch.
I mean, to the everyday person, if you work in a small company, I'm not jumping on them. You knew that when you had a business.
Right, right.
If it costs us at the city that kind of money, when you're in a small company, and then if you're I can remember the company I worked at, 2 major operations killed them. They were major. And,
Right.
when that actuary came in and said, well, you know what? That's why you need group plans, and there's not a lot of them.
Right.
Either that, or you got to have this plan here where it's like a group plan, But, you know,
Everybody's in. Makes it affordable to all.
how's the insurance company's gonna react? Not too happy, right?
Well, the insurance and big pharma are not in favor of this, of course.
Yeah.
But you know, their business model is crumbling. You cannot own a business, as we both know, to where you keep outpricing your customers so that you're left with no customers. So who's paying the bills? They're doing it through our tax system.
It's like somebody
They're
shot.
taxing us and giving them welfare,
Well, it's
is
like
what they're
somebody
doing.
somebody shots the price of them. You know, you get them like once a year, once every 2 years. And some of these medications,
Right.
you know, I remember when my daughter, she was a pharmacist, and she told me the price of some of these pills, and I go, ooh, you know, how do you know, if you ain't got insurance, I mean,
Some people are dying because they just can't afford the pills. So they just don't buy them and they die. But I just want to tell you a few more things.
Yeah.
Wendell Potter is coming to town on Saturday. Wendell Potter is a big whistleblower for the healthcare industry. He was a former corporate public relations executive at Humana, and then he went to work for Cigna. Well, one day he had an epiphany and realized he could no longer work for them. And so he has since written some books. He established this online newspaper called tarbell.org, and he has published really in-depth investigative journalism on the health insurance industry and big pharma. So he's coming to town Saturday for breakfast, and we're inviting the general public, if they want to come, to call and make a reservation. It's going to be at LaRue Dix, which is on...
Is that a new place?
No, it's on West 10th Street between the Playhouse and the Y.
Oh, okay.
Yeah, so they have a little place in there. It's quite lovely.
When did they open?
They've been open for a while, but they're not a restaurant per se. They're
Oh.
a place where you rent out and you can have
Ah,
parties
that's why.
there.
Okay.
Yes. So it's going to be there, and Sabella's is catering it. They're always good. I hope I can put in that little plug for
Yeah, you can.
Sabella's. So there is a cost to that, and they can call to make reservations. And we'd be happy to have them come. He's an excellent speaker with a lot of information.
Yeah, people are gonna have to start getting involved because, I mean, here at the city, we look at it all the time. It's, you know, we have a obligation. You know, we made contractual obligations, and because of that, you know, it's getting tough to,
Balance that budget.
Yeah,
With healthcare costs that keep going up every year. And a lot of small businesses, go ahead.
that's okay. Go ahead, caller.
I got another question I was thinking.
Go ahead.
Percent, say your household is $50,000, your income. That's $1,500 a year, right?
Correct.
$1,500 for you and $1,500.
No. $1,500 total for that $50,000, total.
If
So-
you have kids at home, does that include them?
Oh, it certainly does. Everybody that is supported by that income, yes.
That's great. If that's what it is. That's great.
And remember, like Cindy said, this is all in, you know, still in the design phase.
Yeah.
So it's important that the public, when you have these hearings, you got to tell the legislators what you would like to see, so that yes, your kids are included and all that, you know.
Yeah.
Because, you know, if it doesn't happen, I don't know how, you know, we got people now that will not go to the doctor.
And I'm sure you're going to have pre-existing.
No. No one's going to ask you what. Everyone is covered, period. We don't care if you have 10 pre-existing conditions or you're the healthiest person and never need to see a doctor. You are covered. That's the only way this works, is everybody is covered.
Will there be a cap on anything, though?
No caps. No
Great.
caps.
Great. Okay. Thank you.
And and how we've written in the bill is this can only increase by a certain amount every year.
Can you hold 1 second?
This can only ever increase that amount if there's some natural catastrophe, let's say we have Ebola hits Pennsylvania one year.
Yeah.
Then we realize we'd have to increase that, but that's the only way that increases.
Go ahead, caller.
Cindy, I have a question. Would acupuncture be covered under this plan? Would massage therapy be covered under this plan? Would chiropractic care be covered under this plan? You know, because a lot of people, more and more people today want to go towards those healthy modalities as opposed to going and just getting a pill and popping a pill and, you know, then having several side effects and having to pop more pills. But would those modalities be covered under this plan?
Let me just tell you, the committee that I work on, or the nonprofit I work on, we have a lot of physicians on that board of directors. And how they would like to see this set up is a big board of directors with somebody from all of these places being part of that board to construct what it all covers.
From the different areas of
From
medicine.
the different areas of medicine and patient advocates and everything. How it's worded is, and the bill is only 36 pages long, so anyone can read it, it's right online. But how it's worded is medically necessary. So that board of directors would certainly sit down, because I'm sure all of us want to make sure that it's good sound medicine. I mean, acupuncture right now is more and more common and is very respected. But I can tell you, I had a very dear friend who passed of cancer, whose family almost went bankrupt by somebody who I considered a charlatan. So I think we need to protect people, as well as make sure that people have the choices they want and need.
Okay. You know, when I think about you get to choose your own doctor and stuff, and not to bring politics into it, but I do remember that there was one president at one point here recently who his favorite phrase was, "You get to keep your doctor." Yeah. We all know how that went.
Yeah, well, that's because in that bill, they allowed the insurance companies to keep control.
Uh-huh.
So under this bill, that's not true. The citizens have control.
So this panel that would decide whether or not your care is medically necessary. I mean, after practicing medicine, I realized I was always taught, and it was always the most common sense thing, is the pain is what the patient says it is. So if the patient says that being my massage therapist for my arthritis is very helpful, would they have to go in front of a board?
No, no. Please know that nobody's going to look at individual patients like they do now. Nobody's sitting in a room going through paperwork. This board of directors would just establish the rules, and that, of course, would be open to challenge, but these are blanket rules for everyone, and that's how it would happen. Nobody's going to look at individual patients and say, we don't like this, you can have this.
Well,
No.
it's like the insurance companies now. You're still there, right, ma'am?
Yeah.
They kind of tell you, if it's, you know, certain things they make decisions on, and then your doctor has to fight with them.
Right.
And, you know, so you're going to, I imagine even with this plan here, there'll be general guidelines, but if your doctor thinks you need something, you know, like if they say normally you would only get that shot once a year or something, but if your doctor says, no, you should be twice a year, and, you know, he's going to have to make his case, I think there'll be like...
I'm sure there'll be
Yeah.
that give and take, but no one's looking at
No.
people individually.
It won't be, I don't
you-
think it'd be any different than it is now, where you have guidelines and, you
Right,
know.
you have those guidelines. I have a friend who owns a medical practice in Gettysburg. It's a small
You
practice.
still there, ma'am?
Yes. I'm
Oh, okay.
listening.
It's a small practice. They have 5 docs in the practice. They pay a staff person whose job it is full-time to deal with the insurance industry.
Well, yeah, you got,
That's it, full-time. So under this plan, doctors in private practice would save a lot of money. So there's so many benefits to so many different people, and there's a lot of doctors who want to practice the way they've been taught in what they want to do that have their hands tied now because of what they're told they can do.
Yep.
I know for myself, I would prefer to see a holistic practitioner and approach my health. I don't want to use the words health care, but my health from that direction. But in order to do that, now if I want to go, let's say there's a practitioner in Cleveland or in Pittsburgh, right up front you have to pay like $500 because of, unfortunately, the insurance issues, and they don't take insurance, and, you know, so it's a double-edged sword in that way. So if this type of program would allow people to see the care provider of their choice, that would be a good thing.
Yes, it would. There is one more thing I'd like to talk about, if I may.
Okay. Are you done, ma'am, or?
Yeah, I'm going to hang up, and thank you again, Cindy, for coming on.
Oh, thank you.
One of our more successful shows.
Oh,
Go ahead.
Good, thanks. There's a gentleman from Easton, PA. He's the CEO of a company there. He believes so strongly that single payer will help the business community that he funded a documentary called Fix It. This documentary anyone can look at. It's online. Or if they can't get it online, they can let me know. I'd be happy to send them a copy.
You just look up Fix It, is that it?
It's fixithealthcare.com. I don't know if the camera can see it from
No,
there.
probably not, but.
It's www.fixithealthcare.com. And this gives such a wonderful explanation about our bill and what it means.
Can you hold on one second, please?
And there's a lot of people from doctors and other people from Pennsylvania in the documentary. It's a great primer on this.
Go ahead, caller.
Okay, hi, Chaz. If I can change the subject for a minute.
Okay.
There's some discussion about when the president came to visit last week about who was going to pay for his visit and all the police protection and all that.
Yeah, I was here when George Bush came in. I was a controller. And good luck in getting the government to pay for it. If it's a strictly campaign visit, you can send a bill into the campaign committee. But when you're dealing with the president, he's going to mix business and pleasure. And so good luck. But go ahead. What's your question?
Well, the thing is, in today's paper, page A4,
Yeah.
okay, it says, President goes on rally blitz. And towards the end of the article, there's Trump's campaign been investing heavily in his recent tour, covering all the costs of organizing and paying for the rallies. That's a quote from the newspaper, Associated Press.
What did it say? I didn't hear him at the end.
He was covering all the costs of organizing and paying for the rallies.
Well, our mayor sent a bill in. Let's see what happens.
Okay, and this is from the Associated Press. That's an article. That's in print today.
Yeah, it'd be interesting. Well, the mayor did send him a bill. At least he said he did. I'll double check with that. And we don't have all the numbers in anyway. The article in the newspaper was premature. That covers things we know, but there are other things we don't know yet. That'll be, there's fuel costs and everything else. So it'll be a little bit more than that, but I think from what I understand, the mayor did send a bill into him. We have tried in the past. Sometimes it works, but most of the time it didn't. But if it is going to pay, it would definitely help us.
Yeah. Well, it's besides the city of Erie. Mill Creek is involved.
Oh, yeah, it's State, Mill Creek, and...
I've seen, on 12th Street, they had the police from Presque Isle were doing traffic control.
Well, when you're in Chicago, I was there when Obama was passing through, and they shut the whole interstate down from the downtown to O'Hare Airport. Now, Chicago has a lot of police cars. We don't. So, I was told we were using garbage trucks and other stuff, and I'm sure they called in Mill Creek, probably Presque Isle, and like you say, every agency they could find, including the state police. So yes, this, obviously when security, I imagine they had 12th Street cleared when he came down it.
Well, Kaz, it was more in 12th Street. From what I heard, he came down 26th,
Oh, he did?
but they had 12th Street closed. They had the Bayfront Highway closed.
Yep.
They had the bridge by Strong Vinton closed.
I'd be curious where they got all these, well, I can tell you, when John Kerry was here, and I had the privilege of driving in his motorcade, you could not see anybody on any bridges or any on or off ramps. So they do a job like, and they are good at it. But I don't know where they got all the, I'm curious where they got everybody.
Well, as far as I know, they're running interference. They didn't want anybody to know which route he was taking.
Yeah, they kept it quiet. I can tell you, even the parking authority, a day or so before, did not even know what streets they were closing, so they couldn't plan on how to get people out of the ramps because they were told they couldn't exit onto certain streets. And there was that much secrecy, maybe too much. I mean, you had to know which major streets were closed. At least they could have planned that way. So there was no backup plan, like how to handle the overflow of people. There were, parking. They didn't know how the ramps were going to be affected. It was definitely different than anything I've seen in the past.
Yeah. Well, I was down at 10th and State for with the Democrats doing our peaceful rally. It wasn't very peaceful when the Trump supporters came by and started yelling stuff at us.
I'm always amazed that the last time when Bush was here, you were four blocks away, and this time you're about 4 blocks away. So I don't think he heard you.
Well, Kaz, we're allowed to protest.
Pardon?
We are allowed to protest, and that was an organized protest.
Yes, you are, and I tell you,
by the Democrats.
It's amazing. When I was a young man and people like Hubert Humphrey came to town and Richard Nixon, and they had protest was big back in my day, and they were right out the airport, right down. When Humphrey came in, they were yelling about Vietnam at the other end, and today you really can protest, but you really can't. You're far back and national security, they call it, but good luck getting your point across,
Well, if we could just keep it civil, that's the thing that's lacking.
Yeah, hey, in the old days they used to have rallies, and I get, protest was always big.
Well, if the protesters, Kaz, we had Scott Wagner threatening the Tom Wolf on his internet page. Did you see that? Did you see that video?
I have to watch. I can't talk politics on her because they get mad at me and they'll take me off the air then. So we got to be careful. But thank you for your comments.
Well, that's what I'm just saying. Keep it civil.
I agree with you.
Civility. This is really bad.
I remember when I first ran for office, I beat 3 gentlemen, and I invited them all to my inaugural, and they all came. One was a Republican, 2 were Democrats. And the civility was a lot better back then. Today, it's not fun anymore running. It really isn't.
It's mean and nasty with the politicians and their supporters. It's tough out.
Yeah, when you lose, you ought to shake your guy's hand and just walk off,
Oh, that's not happening anymore.
No, it isn't.
I'll let you go.
Well, you got about at least 12 minutes. Go ahead.
Good.
You're getting a lot of calls at least, so.
Oh, that's wonderful. Well, I just want to make sure that everyone knows they can watch FixItHealthcare.com, watch the movie, and know that Wendell Potter's coming. Now, Wendell Potter was here at the Jefferson last year.
Oh, he was?
Yes, because he started the online newspaper Tarbell.com. And in it, his articles are pretty extensive, and he's the one that I got the information from, titled How Health Insurers Drive Huge Profits Off of Older Americans. And it's pretty interesting and in-depth reporting.
Well, I know how much my mother pays, and Go ahead, caller.
Yeah, Cindy, thanks a lot for this. This is way overdue. And I want to make this real quick. I want to tell you 2 quick stories. I was talking to a guy from Toronto, Canada, and I don't even know how we got on the subject, but I said, so let me ask you a question, buddy. How do you like your national health care? And the man started laughing at me. And this was at the Mill Creek Mall. And he says, I wake up every morning and I feel like I hit the lottery, that I don't have to worry about that I know where my paycheck and my money's going, and we couldn't be happier with it. Next time I'm in Rochester, New York over Labor Day, sitting in a hotel lobby. Well, I had open heart and I'm on Coumadin and this and that, and this guy happened to say to me, well, I'm also on Coumadin, so we're talking back and forth. And this one really almost made me fall out of my chair. And I said, well, how do you like your health care? And he goes, you'll have to pry it from my cold, dead hands.
Was he Charlton Heston reinstated, huh?
That's what he said, Kaz. So thanks. Good luck, Cindy.
Oh, thank you.
And yet you hear these horror stories, right?
I'll tell you a story about that, but first I want to say to the caller, you remind me of my husband. He does the same thing. Because in Pennsylvania, we don't charge tax on clothing. We get these busloads of Canadians in and people shopping. Whenever my husband sees a Canadian license plate and sees them by their car, he asks them, how do you like your health care? Not one of them
Ever said anything bad?
has said anything bad, not one. And a couple of them say, we don't know what's wrong with you Americans. But, you know, I understand years ago, there was a radio talk show somewhere in the Commonwealth, and one of my members, because our nonprofit is a statewide organization, said, Cindy, why don't you listen to this program? So I'm listening to the radio show, and this person was on saying, you know, about how Canadians stand in line for their health care. And he said he used to live in Meadville, Pennsylvania, and people would come over from Canada by the boatloads. And I, of course, had to respond and say, I don't know what you're talking about. I don't see boats from Canada coming into Erie, period. But this lady called in and she said, I live in Florida and I'm from Erie, and that doesn't happen, number one. And number two, I have friends in the apartment complex I live in from Canada, and they love their health care. So I think what we need to see is a lot of this is coming from the people that are going to be threatened by everyone having this kind of health care.
Well, it's like social media.
Yes.
You know, if you can plant the questions, and you've been in politics. You can plant the questions ahead of time.
Right.
And, you know, plant the seeds. But, you know, what we need is bring some Canadians in and say, you know,
Right.
line up 100 Canadians, you know, prove we didn't pay them off and say,
Right.
what do you think, right? I mean, we got to wait in line now.
Oh, well, sure. My husband waited 3 months for his knee replacement. That didn't happen immediately when he blew his knee out.
I mean, I use it like the endocrinologist. The one was not taking people for a while, and I needed to be looked at.
Right.
Not that I was urgent, but, you know, 3 and 4 months is too much. Same thing, we have trouble with eye care. There's not, you know, they're having trouble finding doctors that come up here. So you might have to, you know, wait a little bit. So, I mean, it's not like our system's perfect either by any chance, you know.
Right. Absolutely. So I think...
And maybe if we can find a way to educate young kids as doctors, so we don't have this shortage, you know.
Well, we're going to that's one of the downfalls. We're going to have a big shortage when everyone finally has health care, when these people that haven't been to the dentist in 5 years finally can go. But we have a lot of people that work in low pay and jobs answering call centers at the insurance company that actually in this bill, there's money for them for retraining. We would love to see most of them go into retraining in the medical field.
Where they need it now.
Where they will definitely be needed and paid more. So there's so many different benefits to all of this. So I invite everyone to go to our website, which is healthcareforallpa.org, and it's the number 4, healthcareforallpa.org. They can read the bill there, they can learn more about this, and I would encourage them to look at Fix It.
Well, look at right now.
Learn more.
Everybody's got to decide, the next month or two what they're going to do.
Right.
And elderly get confused. They really do. Not because, they're older, and it's a I don't even understand it. Healthcare is like one of those things, it's like buying a ticket on an airplane. 100 seats, 100 different prices. And nobody knows what the heck's going on.
Well, when my parents, after they passed Medicare Part D, I went down to Florida. I spent a whole week trying to help my parents choose which plan was best for them. They each had to get a different plan based on the different meds that they were taking. And then my mother found out a year later she was no longer, although Medicare was paying, she was no longer on Medicare. It was an Advantage plan that she was getting all her care from. So it's like they make it convoluted because they benefit.
Yep, you got 5 minutes, he's told us.
5 minutes, okay. Yep. So.
You can get whatever you want in, Cindy. Sure.
Okay. Well, I hope everyone who wants to come and see Wendell Potter will. It's 10 o'clock Saturday morning. And they can email me at Cindy Purvis. That's Purvis is P as in Paul, U-R, V as in Victor, I-S, the number 60 at gmail.com. And I'll hold a ticket for them. It'll be a great event. But I would encourage them to learn more, to talk to people.
And watch when these, when they start rolling this out.
Right.
Get involved. I'm sure they'll have workshops and seminars.
They'll have all of that. And we've been out talking to our state legislators because this is a state bill. And please know that we're doing this like Saskatchewan. We feel we need a national health care plan. In Canada, they passed it in Saskatchewan first. And once everyone saw it worked, then it spread throughout the entire country. That's how they did it. So a big state like Pennsylvania needs to be first to show the rest of the country it can go. So we really need to, once this election's over with, and it doesn't, if you're a Republican, you have a Republican representative or senator, go and talk to them. This is a nonpartisan bill.
I think, I was going to tell you that people should I always tell people, fine, you talk to me. But on issues that are above me, you got to go to your legislators.
Right.
Because this is where it's going to happen.
Right.
It's not going to happen locally.
Right.
And they should, is there like some kind of bill that they could tell them, or?
Oh, yes, the bill.
Because, talk to them all. Talk, even if they're not your legislator.
Right.
Call them.
Call them,
Call Brad Rowe and
absolutely.
call them all.
Well,
Call Pat Harkins.
In the House, and Pat Harkins has signed on to this bill. So if you talk to Pat Harkins, thank him. It's in the House, it's House Bill 1688. In the Senate, it's Senate Bill 1014. And they're mirrored bills, so they're exactly the same.
1688 on the House side, right?
Right.
And 1014 on the
Senate side. So,
and, don't be afraid to tell them, because, even if they don't talk to you, talk to
their staff.
Yep.
Which are all, everyone is aware of these. We have sat down and met with all of them about this. We've given them Fix It. So they are all aware of these bills and aware of what we're trying to do. The thing is, we need to do our jobs as citizens. We need to get behind them and say to them, this is what we need to do for our health, for our financial health, for the health of all of our institutions and businesses. I can only imagine if we pass this in Pennsylvania and we're the first ones, I think businesses are going to come running to Pennsylvania because it will save them a lot of money.
Well, it'd be another tool in the toolbox, that's for sure.
Absolutely, yes. Mm-hmm.
But I think, we're almost.
Well, I want to thank you very much, and your callers for calling in.
Yeah, maybe we'll come back again.
Oh, I would love that.
Keep me informed, like if anything, we got 1 minute, he says.
Okay.
If there's anything that happens between now and then, you know, like an update, even if you only want to come on for 10, 15 minutes, that's fine.
Okay, great. Thank you so
Then
much.
we'll take this call and then we'll go off the air. Go ahead.
One last real quick question. You know how health insurance is mandatory now and, you know, you have to pay it, you can't get out of it? Is this mandatory?
Absolutely. Yes. The only way it works is if everyone's in. And the thing is, you need everyone to be in also for public health. What happens if there's a big epidemic going around? Who are the people that really don't go to the doctors? Those that don't have health insurance. They don't go, and they're usually the ones that are in public working, such as your restaurants, some of your gas stations that serve food, all of those. You need everyone to be covered for the financial health as well as physical health of everyone. So yes, it will be mandatory.
Well, I don't ever like the word mandatory myself. It makes me uncomfortable. It makes me feel like lack of freedom. So if the system is that good, then the matter of choice and educating people, you know, and saying, you know, this is why it's so good and you might want to consider it. But then say for the sake of discussion, if there's somebody who really doesn't subscribe to that, you know, having it be mandatory, I'm uncomfortable with the word mandatory anymore. There's so many mandatory things.
Well, let me just say this is how true insurance works. Everyone puts the money into the pool, and then it's taken out as needed. So if you don't have a large enough pool, it's not going to work. Financially, it would not work.
And what she's saying is you won't have to keep, like your Social Security, extra coverage now.
Right.
Or if you're working, you know, it'll be less for your boss. So, you know, we got to see how they roll it out and, you know. We got to do something, because I tell you, doing nothing, it's killing us even here at the city. And I can imagine it's the same in any major business, the county, the school districts, all of them.
Well, thanks for letting me squeak in that last question, because, you know, it was something that came to mind, and I wanted to do it before you guys were done. And again, Cindy, thanks for coming in, and Kaz, always, thank you so
we might
much.
bring her back here, so we'll keep an update.
Thank you.
And Cindy, is that we're going up the air?
All right, thanks.
You know what I was going to tell you? They were tougher in the Army on handling food than they are around it.
You have been watching Taxpayers Hotline, recorded live from the fabulous city of Erie, Pennsylvania.